The Nebraska Hospital Association exists to provide hospitals with state and federal legislative advocacy, healthcare trend and regulatory information, educational programming, communication, and data reports. Members rely on the NHA for information, advice, and collaborative leadership to advance Nebraska hospitals' ability to provide exceptional healthcare. The mission of the NHA is to be the unified voice for Nebraska's hospitals and health systems. NHA provides collaborative leadership, assisting its members to provide comprehensive care to their communities, improving the health status of those communities.
From a regulatory perspective, we in Nebraska are very fortunate that the NHA is very proactive. They stay informed, they stay abreast of the current trends and healthcare and keep us informed so that we can maximize reimbursement and keep our hospitals profitable and able to provide the services we need to provide. It's very important for the Hospital Association and the member CEOs of the board and the association to attend the meetings in Washington, D.C. If we don't go and visit with our Senate and congressional leaders, they're not aware of what our needs are and what we would like them to do for us as advocates for the healthcare industry. The last trip we made to D.C. was very profitable for us, very informative, and I think it's very worthwhile that all members try to go as they are able to. The physician supervision issue is very important for the critical access hospitals as well as non-critical access hospitals in the state of Nebraska. NHA's worked very hard to inform CMS as to what the impact would be for those member hospitals if they do not make the right decision. It's important that NHA stay involved and keep us involved and informed as to what their efforts are.
The NHA's advocacy efforts tremendously benefit Nebraska's hospitals. There are countless issues and decisions every single day that are made in Lincoln, and in order for us to be effectively represented, we have to have the NHA speaking on behalf of the membership every single day, providing information, education, and of course really trying to influence policy in positive ways that will serve all of our communities and help our organizations to be viable and effective in carrying out their mission. The Nebraska Hospital Association was extremely effective and engaged in speaking on behalf of our membership in the legislature in supporting LB 999, which was a bill that would have imposed a moratorium on any new hospitals in Nebraska for a period of time so that we could really study all the issues that were involved and help protect our communities and protect community hospitals. You know, I was fortunate to get to work with the NHA staff and see just how respected they are in the Capitol, to see how effective they are with the media, and LB 999 ultimately passed.
Political Action Committee is an effort that allows you, following the rules of government, and they're very stringent rules, to collect donations that can be utilized to share with individuals running for election or re-election in the political arena. I think it's incredibly important because the importance that politicians have on raising money, when you can provide some resources like that, it gives you better access to them and certainly gets their attention and ensures that they are listening to what's important to you. I'll point out that historically we've not done a good job of that. And if you compare us to other industries like education and so forth, our collections have been really quite dismal. Well, you know, this is the first year we've had this organized effort, and we certainly we set a goal to get 100% participation by all the hospitals in the state, and we're going in the right direction on that. I'm very encouraged with the progress we've made to date, but we need to continue to make this a stronger, organized effort. The amount of resources we collect gives us greater access to these people, and again, I think we can do better than we've even done this year, and we need to keep on raising the bar in that scenario.
Fox Butte General Hospital has participated for years in the Nebraska Hospital Association offerings, from a great number of webinars, particularly the ones in the areas where we feel like we need more support, where we have maybe a small department being a small hospital. We really benefit from the networking and the collaboration that you get through the NHA webinars. We've always attended the Hospital Association annual meetings, and we send a number of participants from a broad range, and of course we bring our Caring Kind awardee to that, which is wonderful to celebrate, excellence. I can say a lot about the Leadership Institute because as an organization, we've participated since it first began, and we've had participants every single year. I think the Leadership Institute was designed to obviously develop leaders, and that I can certainly attest to does happen. I personally participated in 2005-06, and I was one of those that had been in the management role for a very long time, but felt that there were some areas that I was struggling with that I felt I could improve on and continue to develop myself and become a stronger leader, and I certainly felt that that happened. Hospitals should participate because as a group, they can do more.
When errors occur in small rural hospitals, they occur so infrequently that we may think that they are random acts or things that occur so infrequently that they're not going to happen again. Where if we compile this data together, which is what the Nebraska Coalition for Patient Safety does, we can discover that there are patterns to these errors, and therefore we can change our practices to eliminate those errors from happening in the future. The Coalition collects data from all these particular hospitals, so when we have more hospitals join the Coalition, we get more data available, which causes patterns to emerge more quickly, and we're able to change our practices in response to those data collection patterns and provide safer, better, high-quality care.
NHA health data is very beneficial to Nebraska hospitals. In our case, we like to use it, and we find that knowledge is power. The information that's accurate and timely can be helpful not only in our day-to-day operations, it's helpful with our strategic planning, it's helpful in our relationships with our physicians, it helps us plan projects. It's a baseline to make your hospital work better. We analyze our pricing and market data in a number of different ways. Not only do we use it locally, our health system sponsor also uses it. We use it to monitor our pricing against our competitors in the market area. We use it to determine our market share. We also use it and find it helpful when we do bonds and other types of financial activities. It helps those who work with us understand our operation better and where we stand as the health provider in the area.
NHA Services was originally created to offer reasonable rates for workman's comp insurance to the members of NHA. This resulted in savings of millions of dollars to the NHA members in insurance premiums. And today, NHA Services does contract with numerous vendors to offer additional savings and discounts to its members. One of the ways they have helped us is with the joint venture of NHA Services, LMC, and Farm Bureau Insurance. Their joint venture has allowed them to come in and offer management workshops to our facility in areas such as safety management, Workman's Comp 101, and accident reporting. Then they also provided us with materials to produce a safety manual for our facility. Just these two events alone has caused us to create a culture of safety in our facility for us. We also have the opportunity to belong to an NHA safety committee, and the safety committee then will have 2 workshops during the year that all NHA members can go to, and this allows them to get all the safety education and updates on workman's comp throughout the year. In addition to that, they have online services through the MyWave program, and Farm Bureau also has a nice online claims reporting service and a claims management service.
Bioelectronics is a service that Kearney County Health Services used for a number of years, and it's helped us in many ways, mainly keeping our equipment up to date. And also, whenever we need a bioelectronics technician, they're readily available to come and take care of our problems. So it's been a really good relationship working with bioelectronics. It saves us a number of dollars, and I would say that if anyone's looking for a good value, they should turn to bioelectronics, because bioelectronics saves us a lot of money when it comes to keeping our equipment up, rather than being tied to maintenance contracts that are very expensive.
It's very important for all hospitals in Nebraska to be members of NHA. NHA is the unified voice for all of us, and there really is safety in numbers. Bryan LGH Health System is a long-standing member of NHA, and we think that the association's role in advocacy, especially at the state level, is vitally important to our future, and that's one of the many reasons why we belong to NHA.
Our vision is to be the influential voice in the state on healthcare issues. Nebraska is home to healthy communities, where hospitals are known as leaders on quality initiatives. Healthcare sets the standard for service excellence, and Nebraska's hospitals foster innovation. Working from this set of shared values, healthcare has come to be the industry of choice in the state. Building on the strength and collaboration, the NHA fosters communication and cooperation with other organizations that share the NHA mission, values, and vision. These partnerships are working to create new solutions to complex issues such as healthcare workforce shortages, patient safety, and promoting insurance coverage for all our citizens.